Hi, I'm Cathy Elliott and I'm one of the senior leaders within our West Yorkshire Health and Care Partnership. I wanted to share with you the work of NHS West Yorkshire's board since we were set up as a statutory body on the 1st of July under government legislation and the Health and Care Act. We've been working hard to make sure that we complement and support the ways in which our partnership and system has been working for many years, building on really sound and positive foundations. Our first meeting on the 1st of July was very transactional in setting us up as a statutory body, and our first full meeting in public set us up as, I hope, how we mean to go on. Our first meeting on the 20th of September was held at the Carlisle Business Centre in Bradford, and before the meeting, board members went along to a listen and engagement session with young people and carers to hear about their lived experience of children and young people's services, and the plan overall in our system, as well as then how that is worked and delivered across our 5 strong place systems. Our first meeting in September also looked at our winter planning, preparing to meet the objectives and targets from NHS England, the 6 metrics for winter, as well as ways in which places are preparing and delivering for this really exceptional winter. And there were a variety of other projects and also themes and items that came through that meeting, including our finance strategy and principles in working together. And for those of you working across places and provider collaboratives, I hope that finance strategy and the principles in way we work together are helpful to you as you come together to look at how you can pool resources and work differently. And as we look ahead to our next NHS West Yorkshire Board meeting in November, it's going to take place on the 15th of November in Huddersfield. Our focus on topic will be around general practice, and we will have a session before the meeting to hear from people's experiences in using general practice services and then bring that into our meeting, as well as looking at priority topics, including winter delivery and planning. And there is the opportunity to get involved with all NHS West Yorkshire meetings in public. You can ask a question in advance, and if you manage to get your question in before 9 o'clock the day before the meeting, then we will ask that for you and answer it in the meeting. If you unfortunately miss that deadline, we will provide a written response. So the deadline for this next meeting is 9 AM on the 14th of November. You can also come and watch part or all of the meeting online or come along in person. And the documents for the meeting are available on our website, and there might be documents there or topics that are of interest to your work due to your place working programme or service delivery that you're a part of. So I really encourage you to come and get involved and come and get to know the work of NHS West Yorkshire's board in more detail. We'll meet again in public in January and then in March. And one of the things we will take through in all those meetings, one is having a focus on topic. We will also be looking at making sure that we've got oversight and scrutiny of the ways in which we're delivering for NHS England, but we'll also be embedding citizens' voices in the ways of working which we are committed to right from the start. And I really want to thank Healthwatch for their support in this. We will be setting up soon a people or citizens panel to work with NHS West Yorkshire, and we are looking for people to get involved. This is really important to the way that we are working, making sure that we have lived experience in the room when we are making decisions. So please get in touch if that's something of interest to you. The other thing I wanted to share with you is how we're connecting the work of the Partnership Board, our now Integrated Care Partnership, and the strategic aims that we have, those 10 ambitions that are currently being refreshed, and we'll hear more about at our 6th of December Partnership Board meeting. But the ways we are working immediately together, such as responding to the cost of living crisis. And I'm pleased that's extended in working with West Yorkshire's Combined Authority as well, reflecting what people are doing and organisations are doing here and now, as well as planning well for the future. So it leaves me just to say thank you for all you're doing, particularly at this really pressured time. It is really appreciated, and take good care. Thank you.